gone, it's an empty home. Come on back where you really belong. You are always welcome home, welcome home.
I welcome you to DAF Speaks. Today on the show, we'll be talking about the diplomatic trip to West Africa with Ghana as a gateway. So we are having a team of 10, and they are made up of physicians and non-physicians from the Society of Critical Care Medicine, and that is SCCM. And they are on a project to launch the $5.5 million project in Africa, dubbed Africa Infrastructure Relief and Support. Now, ahead of the team, we have Dr. Nelson Williams. He arrived in Ghana on the 15th of February ahead of the project, which is slated to begin from the 17th to the 24th of 2023 in the countries of Gambia, Sierra Leone, and Liberia. I have Dr. Nelson Williams with me on the phone. Hi, Dr. Nelson Williams. How are you doing?
Hi, Charity. It's a pleasure to be here. I'm doing very well. Thank you.
Yes, and it's a pleasure to have you on DAF Speaks.
Thank you.
How does it feel to be back to the motherland? I know you've been to Ghana before, and how does it feel this time around?
Well, it does feel good. I think the last time I was here was about a decade ago. But it does feel good to be in the African continent. It feels good to be in Ghana, especially since it's on the way to the other countries where we'll be doing the work of this project.
Have you had some wache, some Ghanaian dish to eat?
So I just arrived yesterday, so I haven't had time to do a lot of food exploration, but I definitely will today or tomorrow since I'm here for the next couple of days.
That's great. Welcome home, Dr. Nelson.
Medasi, thank you very much.
Oh, that's great. So Medasi is actually thank you in the local dialect of Ghana. That's the Chi. So Dr. Nelson, I actually know you to be, Dr. Nelson Williams, one of the, the people from the medical fraternity embarking on this life-transforming initiative in Africa. But in a jiffy, can you kindly introduce yourself and, tell us who you are?
My name is Dr. Howard Nelson Williams. I am originally from Sierra Leone. I'm now based in the U.S. I work with the Johns Hopkins University Global Alliance for Perioperative Care on this particular project, but I also have a role in gene therapy in another role that I do in the pharmaceutical industry. But in general, I am passionate about Africa and its healthcare system, improving the healthcare infrastructure in Africa. And I have been involved in many projects that have tried to promote that health strengthening and build capacity of healthcare providers in Africa, in both East Africa and West Africa. And this is something that is a connecting thread to what I've done in the past and this project that we're currently on. So I'm delighted to be a part of this project. I feel it's an opportunity for me to contribute to contribute to the development of healthcare in Africa.
Interesting. So this is actually not even your maiden project. You've actually had some in the past. Now, I would like to find out, what is the inspiration behind you even being in the health fraternity? Why are you a doctor?
Good question. So I was born and raised in Sierra Leone, especially at the time when we had a decade-long civil war. And the experience of witnessing so much trauma and disease and death in my community was what ignited a desire for me to help others. And I thought that one good way to help people would be to provide medical care for them. And so that's how I pursued medicine as a career path and subsequently public health. So this has been my driving force in terms of my career over time. And it's still true today that I want to continue to help people get improved medical care, access to good medical and high quality medical care. And that's why we're on this project as well.
Okay, right, that's great. So from February 17th to 24th this year, that's 2023, you happen to be part of the the group, the delegation to embark on the project to launch Africa Infrastructure and Relief, support initiative. What actually inspired this vision?
So this project is brought together by a group of partners. It's based on a grant that was obtained from the Direct Relief. So it brings together the Society of Critical Care Medicine, the Johns Hopkins University Global Alliance of Perioperative Professionals, as well as the Institute of Global Perioperative Care, along with partnership with DAF. To put together a project that would improve the oxygen and solar infrastructure in countries that need it the most. And this is a continuation of health systems strengthening programs and clinical training programs that Johns Hopkins University Global Alliance of Perioperative Professionals. That's a lot of words. I'll just say GAPP going forward. It's a continuation of the kind of work that we've done in the last decade in Sierra Leone and in other places in West and East Africa. So we're constantly looking for ways where we can build capacity based on the initial work and relationships that we've already established in the various countries that we've worked in. So to answer your question, there's just a burning desire to help promote increased access to high quality healthcare.
Okay, that's great. That's great. While speaking, you made mention of the SCCM. Can you kindly talk to us about that?
So we're partnering with SCCM. SCCM is it's a large, very large, in fact, the largest nonprofit organization that is dedicated to providing medical excellence in critical care. So it's a critical care organization. It has membership of more than 17,000 critical care professionals from over 100 countries around the world. And so they are the main partner in this. And we're happy to work with them.
That's great. Now, with the group you're part of, the GAPP, can you please enlighten us on that?
Okay, so the mission of GAPP is to provide relevant, appropriate, affordable, and sustainable solutions to improve anesthesia and perioperative care, that is any sort of medical care around surgeries in low resource environments. This is what GAPP intends to do. In fact, the tag of GAPP is to close the gap in global health issues, right? So there's a group of very dynamic and passionate physicians and other healthcare providers, like nurses and other aspects of healthcare, who are coming together to support the growth of anesthesia care and perioperative care in environments, particularly like we have here in West Africa, where we're struggling with basic resources. So this is the fundamental purpose of this group, and this is the guiding reason why we choose the countries that we work in.
Interesting. Wow. Now, to my next question. There are other continents of the world that you could have chosen to do this initiative, on, but why did you actually choose Africa?
Well, thank you for that question. It is said that charity begins at home. I am a son of the soil.
Yes.
a number of people in the team are of African descent, either born and raised on the African continent or have historical connections to Africa. That is one aspect of it. The other aspect is that Africa remains the place that really has some of the greatest needs, in terms of healthcare improvement. So for those two reasons alone, and there are other reasons, but for those two reasons alone, Africa becomes a very good destination for us to target our attention and our resources to see how we can help the local parties and the local partners to make a difference in the lives of patients, in the lives of communities, because at the end of the day, that is what we want, to improve the health outcomes of people, everyday people living in these communities who are having difficulty in accessing care or accessing high quality medical care.
Wow.
That could actually save lives.
Wow, that is really phenomenal. Listening to you, it reminds me of this symbol, the Edinkra symbol called the Sankofa. Yes, I don't know if you've actually had the chance to see the Sankofa symbol, but it is, it's actually having the inspiration of coming back to your root. And I think it's really, really commendable seeing, people, historical diasporans and continental diasporans embark on, initiatives to their roots. And I think that's a great thing. And now to the next question. There are actually 54 countries in Africa. So among the 54 countries, what was so exceptional about Gambia, Sierra Leone, and Liberia that informed your choice?
So one of the things is that, again, these countries have some of the greatest needs around healthcare. Some of the highest mortality and morbidity, among especially women and children, are found in these countries. In addition to that, over the last 5 to 10 years, in the work that GAPP has done, and SCCM also, in terms of their critical care programs, we have built relationships in these countries. We sort of understand the layout of the medical system in these countries. We have partnered with local stakeholders before, so it sort of makes it easier to get things moving very quickly in these countries. And since this is the first of its kind project for the Africa Infrastructure and Relief and Support Project from the SCCM, we decided that we would start off in locations that have a really high need for it, and B, that we have relationships that we can execute the project in a very successful way.
Oh, that's great. That's great. So this initiative is actually targeted in such a way that you don't actually do a bad investment, but it actually addresses the very need of these countries. Wow, that's
correct.
That's really great. That's really great. Now take us through how it is going to be done in these countries. What is the nature, of this initiative going to be?
So there are various aspects to the project. Overall, we're trying to develop solar capacity or renewable energy capacity for health facilities, as well as develop medical oxygen, or medical grade oxygen infrastructure in these countries. Many times in these locations, there's interruptions of electricity that affect how clinical care is administered. So if you go to the hospital and there's no electricity, there are many services that you might not be able to have. The labs might not work right. Basic things that you need to assess the patient and provide treatment will not be available. Similarly, if you do not have medical grade oxygen, There are many conditions that need oxygen, medical grade oxygen, for you to treat them, especially critical care services. If someone is coming in, let's say with the COVID that we just experienced as a world, with the global pandemic, oxygen is a really important thing for people to have, because if you have a condition affecting your respiratory system, you want to make sure that there's enough oxygen reaching your lungs. And so then if you have trouble with that, additional oxygen would be a lifesaver potentially. So most of these locations do not have oxygen generating plants. If they have oxygen generating plants, they may not have oxygen being piped to the locations in the hospital that are critical to receive them, say the OR or the ICU and places like that. So what we've done is to try to identify hospitals that need these infrastructure the most. And of course, it's going to be limited because we have a funding that is limited, and we can only do good work if we focus our attention in one place at a time. So what we're going to do is to work in the Gambia. We're going to target the biggest hospital in Banjul, called the Edward Francis Small Teaching Hospital. We're working with the local partners there who are amazing. Team of medical doctors who are leading the hospital and working with the Ministry of Health to provide medical grade oxygen facilities for that hospital. So that means an oxygen plant, a really innovative type of oxygen plant, and then we are going to add to that piping across the hospital to locations that need it the most. So once the oxygen is generated in the plant, it travels through these pipes straight to the locations. In addition, it will have the capacity to fill cylinders, because in these locations, most of the time it's just oxygen that is put into cylinders, and those cylinders have to be transported to the location where the patient is. And if it runs out, they have to go get another cylinder, fill it. So it becomes a little more difficult to manage in case of emergency. But if you have piped oxygen that would come from the source straight to the patient bedside, then it becomes a more efficient process. Time would be saved in a critical situation where the patient needs that very quickly. So that's what we're going to do in the Gambia. And then in Sierra Leone, what we're going to do is to provide solar support for one of the biggest hospitals in the country. This would be in Bo City. It's usually considered the second capital city. It's a 315-bed hospital. That is the referral hospital for that district of Bo, or the city of Bo. And we'll be providing solar energy across the hospital, because in that hospital, there's currently a problem with the supply of constant electricity. So hope that with solar energy, they would have a more regular supply of electricity, and then that would increase their workflow and improve the clinical outcomes for patients. That is in Sierra Leone. The last place would be in Liberia, where we're planning to work at the FJ Grant Memorial Hospital in a place called Greenville, Sino County. So that's a little further out. It's not the capital city, which is Monrovia. It's a further out. It's like a day's trip. If on a good day, in the rainy season, I hear the journey is up to a couple of days even, but on a good day it'll take probably a full day's road trip to get there. That's how far it is from the main capital city. And why it was chosen is because usually it's cut off during the rainy season from everything else. It's hard to reach, so they usually struggle with electricity supply and even with oxygen. So in that hospital in Liberia, what we're doing is combining what we did in the Gambia. We're providing the oxygen plant, generating plant, and the piping. But in addition to that, we're also providing solar to that particular hospital. So, so between those, among those three countries, would have provided oxygen capacity as well as solar capacity. And in addition to that, we're also providing. We understand that it's not just enough for you to go and install a machine or a device in a hospital. You have to prepare for the maintenance, because that maintenance is what keeps the machine or whatever infrastructure you have developed continuing to run in a great state and continuing to help people. So what we're trying to do is identifying biomedical technicians and the engineers locally in each country who we would train or give access to training on these technologies that we're deploying, so that they themselves locally would be able to support the maintenance and take care of these machines and make sure they're optimally run over a long period of time, so that the project continues to impact more and more people as the years goes on. And as we do this work, we're partnering with the local governments, the heads of these hospitals, leadership in healthcare, to make sure this project is a success. We're going to be using local vendors within Africa to make sure that we're also building up that capacity and utilizing the resources that are within Africa to do the work in Africa. And ultimately, we hope that this work will lead to the benefit of patients and communities within these countries. And at the same time, we hope that this work, that is the pilot project, would lead to, if it's done well, which we hope we will do well, would lead to more and more and more of these projects that would bring improvement to the healthcare system in many parts of Africa.
Right. Wow, that is really enlightening. That is really, really in-depth and enlightening. Thank you so much. So, there's over $5 million being, invested into this very initiative. Why is it imperative to invest in Africa? As we draw down the curtains for this session, I would like you to tell us, why it's imperative to invest in Africa.
For me, Africa is home. For a number of people, over 1 billion people, Africa is home. Africa is a wonderful continent that has so much potential. I feel that we have suffered a lot of, as a continent, we have suffered a lot of setbacks in terms of development in many areas. But there is hope in that. There are a lot of new things happening. There's a lot of movement in the positive direction. Young people are stepping up. Things are moving in the right direction in a number of places. And I believe that the problems of Africa will not be solved in one day or by one person or by people outside of the continent. I think that the problems of Africa will be solved by all of us together, who would take up the responsibility of fixing whatever the problems are. So I think that investment in Africa, because of Africa's richness in everything, in resources and human potential, in a promise of becoming a stable and very impactful society, means that we'll be investing in the future of ourselves, in the future of our children, in the future of communities, in the future of countries who are facing setback in different ways. Africa is a beautiful place. Africa has so much potential. There's enormous potential in Africa, and Africans are doing exceptional things, working in very difficult conditions already. So think about, if you just take away some of the barriers that we're facing in our different communities. We're already doing so well with the limitations that we have. So think about taking away some of these limitations, how much more we would do as nations within Africa and as a continent. So I think there's so much value in investing in Africa, and it will take everybody coming to the table, those that are within Africa who have done the work of maintaining things running on the ground, and also those that are outside of Africa who are either of African descent or who have an interest in supporting the growth of Africa. All of those parties need to come together over time, because it will not happen in one day, but over time, to continue to do projects like these, continue to build upon work that has already been done, continue to value the contributions of the people living in the communities, and working hand in hand with them for Africa to reach its maximum potential.
Thank you so much, Dr. Nelson. It was such a great time having you on DAF Speaks. Thank you so much for your time.
Thank you so much for having me. I enjoyed chatting with you. Thank you.
So the one watching us, thank you so much for having time, to listen to this interview. I was not able to get him on one, but that is his voice you heard there. And that is his picture you see displayed there on the screen. One thing that he made mention is that the problem of Africa will be solved by all of us coming together. Indeed, unity is strength, and therefore this is an opportunity to call out onto the people of the diaspora, both historical diasporans and continental diasporans, to come back to their root and embark on projects like this. And this is how I draw down the curtains for this session of DAF Speaks. I had Dr. Nelson Williams with me for this session of the show. Until I come your way next week, it's a bye now.